So today, my job is to give you some of the research highlights in Smartline. Now, Smartline is quite a complex project, so we've got a number of different elements of research going on. So hopefully I'll be able to give you some insights into the project and introduce it to those of you who are new to Smartline. So Smartline is a research project funded by European Regional Development Fund, so we're working with businesses in particular, and I'll touch on some of the business applications as well later. So we have this data that's coming from 300 houses which are owned by Coastline Housing, our partner, and we've put sensors in these houses to collect data on indoor air pollution, energy use, water use. We've conducted surveys with those residents to ask them all kinds of things, some of which are on the slide, things about their health, whether they're active or not, how often they spend indoors. We've asked them about their animals, about the way they dry their washing, and all kinds of things like that. And we've also conducted these guided conversations with them to be able to drill down into depth on what they think will improve their health and well-being. Now, the question is of course, what have we done with that data? And how are we using it? So we've conducted one study that's been recently published on mold and asthma. So this looked in particular at the data on moldy odors and also whether people had certain sizes of mold patches in their homes. And we linked that to the data on whether people had asthma or not. And we found that there was a relationship between moldy odor and asthma, particularly among those who are older. And the question is, well, why is that? Well, we might think that they spend longer indoors, maybe, and that's why we conducted a second study around how people are spending their time indoors, and how does that affect their exposures to indoor air pollution and to things like mold as well. So Cheryl's been conducting a wonderful survey. Cheryl, I didn't have a photograph of you. Can you just wave from the front? So if you want to talk to Cheryl about this study in particular, please do. Please take the opportunity during the break. And Cheryl's just given me some wonderful statistics on our cohort. So the average time people in our cohort spend inside their home differs between seasons. So in the summer, it was about 19 and a half hours indoors, their own home. And in the winter, it was around 20 and a half hours. So these are really significant amounts of time people are spending indoors. So that means that they're exposed to the indoor air, and that's likely to impact on their health. We also find, importantly, that women are spending more time indoors than men on average. So we would expect that women will be more exposed to the indoor environment, and that may have impacts on their asthma if the air quality in their homes is worse. So Cheryl's still working on this analysis, and she's taking it forward to look at these linkages between the asthma data and also linking it to the indoor air, the time spent indoors and the indoor air from the sensors. And so that's still a work in progress, but I think that the time spent inside is something that we really need to think about and note that in these populations, people do spend a lot of their time indoors. We've talked a lot about the guided conversations, and in this, we've been testing with businesses how useful is this mechanism for improving health and well-being. And as we saw yesterday, there's been links to the development of archetypes around the Smartline data. And if you didn't get a chance yesterday, I'd really encourage you today to go over to the Guess Who stand and talk to Andrew and others around there, around the archetypes that we've developed from the Smartline cohort. So you can really get to engage with this data in a richer way. We're conducting a national survey, and that's going out this month, around preferences of people for technology, and also how that may, and also around their health and well-being. Now, why are we doing this? Well, it's important that we take into account that the Smartline cohort are only a very small population. So what we're trying to do is to see how can we relate that to the wider country. You know, are people spending similar amount of time indoors? Are their exposures similar? And so we're comparing across different types of tenure, so whether people own their own homes, whether they live in private rented properties, whether they live in social housing, and seeing are there any differences between these population groups. And Karen Morrissey is particularly looking at how does childhood socioeconomic status impact later on health. And Karen, maybe you can give a wave from the front. So if you want to talk to Karen about that, please take the chance in the coffee break. We're also looking, importantly, at the issue of social networks. And we heard from Ian yesterday from Volunteer Cornwall the role that social networks play in health and well-being. So we've conducted over 100 interviews with Smartline participants to pick out who do these people trust, who do they relate to, who would they lend £10 to maybe. And we're seeing how does that influence their health and well-being. Do people in the cohort relate to similar types of people? Or are they relating to people further away? And also, what impact does the number of connections that people have on their health and well-being? Now, we've talked a lot about our data, and this data is very much, we want to be used, we want to be open with that which we can be open with. So we've got it available on the USmart platform. And if you're interested in accessing the selected data that we've got available, then I encourage you to talk to Ian, who's at the back. And he's standing next to the display with lots of the data shown on it. And we really want to work with businesses and with others in Cornwall to analyse this data. So I encourage you, please, just talk to one of the team if you're interested in going further and in exploring this. Now, our aims for today are really to get insights from you around Smartline, and also to give insights on what's going on around the UK. So we've got various guest speakers who've come, and we're thankful for all those guest speakers who've come and given their time to give you insights into what's going on around the UK on e-health and e-wellbeing. We're hoping that you'll help us to develop Smartline further. When we set up this conference, we didn't know that we'd have the funding for our continuation, but thankfully we have. Hurrah! So this afternoon's session with Karen and Emma takes on a real resonance and importance. You can help shape Smartline as it goes ahead. Are there questions that we aren't asking? Are there things that we should be looking at that we're not looking at? And I hope that you'll stick around with us and participate in that later today. Now, I want to take us on to reflect again on June and Alf, who I introduced you to yesterday. June and Alf are really what Smartline's all about. How can we deliver health and well-being to those who are in our more vulnerable, poorer groups? How can we deliver health and well-being through technology to these groups? How can we best support them? How can businesses work together with academics to deliver solutions that can really improve people's lives? And I'm really grateful for the businesses who've come today to present what they're doing. So I encourage you, during the coffee breaks, please mill around, see what the businesses at the back have on display, and talk to them about their experiences with Smartline. We're really about people. We want to deliver for people in Cornwall and around the UK, and why not around the world, around how technology can really answer some of the big questions that we've got around health and well-being, around indoor environments, around communities, around people's lives. So thanks a lot for listening. And I'd like to thank finally our funders and our partners, so particularly Volunteer Cornwall, who've been so important in delivering and helping us conceptualise the guided conversations, with Cornwall Council and Coastline Housing, who've been wonderful in bringing their data in, bringing their residents into the project and helping us so much.